Our next speaker is MacDonald. Carl has been associated with the People's Mental Health Review, another case of people saying, let's do it for ourselves. Kia ora, Carl.
Kia ora, everyone, here in Christchurch and around the country. Hello. So what I've been tasked with today is to talk to you about mental health in 8 minutes. So we need a review. That's the key point. And I want to talk to you a little bit about why I continue to think that's the case, and in fact why I've come to think that is even more the case since we started the People's Mental Health Review in September last year. But for those of you who haven't read it from cover to cover, and I'm sure most of you have, our report came out in April. The People's Mental Health Review came out of the concern of myself and Mike King, who the two of us run the Nutters Club. For those of you who haven't tuned in, it's on News Talk ZB on Sunday nights at 11. And one of the things that we were hearing from callers over and over again was the same story of frustration and lack of access to mental health services. And the more I spoke to colleagues and the more Mike spoke to people as he toured the country, the more the story was just the same over and over again. So with the Good Folk Action Station, we put together the People's Mental Health Review, which ran for nearly 5 months. And we collected over 500 submissions from around the country, from professionals and mental health consumers and concerned citizens. And the picture was fairly stark, I have to say. We had 93% of our submissions were negative, described negative experiences or concerns. And the figure that the Ministry of Health threw back at us at the time was that 80% of consumers of mental health services were satisfied or very satisfied with service. Incidentally, that is a figure that has been largely debunked by the Auditor General in their recent report. The Auditor General hasn't debunked our figure, so we're going to stick with our number. So. And what came out very clearly from our review was 4 recommendations. The need for urgent funding increase into acute mental health responses, an independent inquiry, and ideally followed up by a full Royal Commission into mental health services in the way they're delivered in New Zealand. The return of fully independent oversight in the form of a mental health commission or similar ombudsman, and a national education campaign. We then had 13,000 signatories to an open letter that we took to Parliament suggesting that the government might want to consider actually reading our report from such diverse characters as all the way from Taika Waititi to Sir Peter Leach, which to me I sort of think of opposites of one another in probably every possible way. And what was clear was that the government weren't interested in hearing about our results. They weren't interested in hearing the concerns of the people. In fact, they've done an awful lot to not only discredit the organisers, Action Station, myself, and others, but they've completely ignored it. And since the People's Mental Health Report has been in the public sphere, we have seen an attempt to spin budget spending as an investment in mental health, as opposed to just ordering DHBs to spend money they don't have on mental health services, and a phone number has been changed as of this week. So one of the things that I think is really important is to talk about why a review. Why do we want a review? Why is this not as simple as actually just putting more money into the system, which a lot of people have asked me. We do need more funding, we all know that, and there's people much more qualified behind me to talk about why and how much and the problems with the figures and why that's so difficult to get clear in the media. However, what is clear is that the problems that we suffer from are the result of chronic underfunding. And so the core message that we try to keep repeating with the People's Mental Health Report is we need more money, but money in and of itself is now not going to fix the problem. We've heard firsthand, and thank you for both coming along and sharing your experiences, we've heard firsthand what happens to a system that is chronically underfunded. You know, I don't believe for one moment that any mental health clinician, psychiatrist, nurse, psychotherapist wakes up in the morning and thinks, I'm going to go to work and I'm going to do a substandard job. I'm going to go to work and I'm going to stop caring about my patients. I'm going to go to work and I'm just going to do the bare minimum because I don't care about what I do. What we know is that professionals do care and they're continually trying to do the best with what they have. The sad reality is they have very little to work with. The more I talk to colleagues, the more I hear that there is a sinking bar, that services are just able to offer less and less. And in some instances, services are able to offer nothing. One of the really clear messages that came through in the People's Mental Health Review was that people wanted not only to, of course, to be able to access a service, that's fairly clear, and a large number of people couldn't access a service at all. But even those within the system weren't able to access a wide range of services, including things like talk therapy and other treatments. So we're seeing clinicians and professionals put in a position where they're not actually able to offer what their clinical training and what the research and what the literature says should be offered to people. We know for mild to moderate depression, for instance, it's really straightforward. You offer talk therapy. We just saw in the media in the last few weeks record number of prescriptions in New Zealand for antidepressant medications, which I believe is a direct result of the fact that that's the only treatment people can offer because there isn't the resources to offer anything else. There's no clinical validation for it. There's no good reason in the literature to be doing that first. In fact, we've got that completely backwards. So I believe that, and we will certainly keep talking about between now and the election, the need for an independent review. We've certainly had pretty much from every major party except the Māori Party and the National Party a commitment to an independent review. What I believe that an independent review would need to look at is how do we actually untangle the effects of chronic underfunding? How do we actually free the service up to let professionals do what they've been trained to do and to actually have a response to people when they are in crisis and need help? I think what you guys are doing are wonderful, absolutely wonderful with the Facebook page, and unfortunately you have to do it. It would be wonderful if we didn't have to have community agencies, if we didn't have to have brave individuals picking up the slack because the system's completely unable to cope. So I don't think we'll see anything different between now and the election, sadly. It's hard to know at this point what exactly it is that will get through to the current government and the current minister. But what I do hope and what I do believe is that stories, as Simon has suggested, do get through. And I do think that the other important point about an independent review is it needs to be a public and open process, because the sad fact of the matter is that the public has also lost faith in our system. And what we know in therapy is when you are able to start talking openly, when we're able to start having those open conversations, that's when healing and change can take place. And I think we need to heal our mental health services in this country. Kia ora.